NCLEX RN Practice Test, Set 3, 30 questions, let's begin. Question number 61. The nurse is administering a dose of prescribed intravenous hydralazine to a client. To provide a safe environment, the nurse should ensure that which safety measure is in place before injecting the medication: A. Central line, B. Thermometer, C. Foley catheter, D. Blood pressure cuff. Answer: letter D, blood pressure cuff. Hydralazine is an antihypertensive medication used in the management of moderate to severe hypertension. The blood pressure and pulse should be monitored frequently after administration, so a blood pressure cuff is the item to have in place. Although intravenous access is needed, a central line is unnecessary. The other options are also unnecessary and are unrelated to the administration of this medication. Priority nursing tip: safety is a priority when an antihypertensive medication is administered because of the risk for hypotension after administration. Question number 62. A hospitalized client is found lying on the floor next to the bed. Once the client is cared for, the nurse completes an incident report. Which written statements exemplify correct documentation on the report? Refer to exhibit, select all that apply. A. The client fell out of bed. B. No bruises or injuries are noted on the client. C. The client apparently climbed over the side rails when the nurse was out of the room. D. The healthcare provider was notified that the client was found lying on the floor next to the bed. E. The client is alert and oriented and stated that he needed to go to the bathroom and didn't want to bother the nurse. F. Vital signs are temperature 98.6 degrees Fahrenheit or 37 degrees Celsius, pulse 78 beats per minute and regular, respiration 16 breaths per minute and regular, blood pressure 188/178 mm mercury. Answer: letter B, D, E, F. An incident report is a tool used by healthcare facilities to document situations that have caused harm or have the potential to cause harm to clients, employees, or visitors. The nurse who identifies the situation initiates the report. The report identifies the people involved in the incident, including witnesses, describes the event, and records the date, time, location, factual findings, actions taken, and any other relevant information. The primary healthcare provider is notified of the incident and completes the report after examining the client. Documentation on the report should always be as factual as possible and needs to avoid accusations. Because the client was found lying on the floor, it is unknown whether the client actually fell out of bed. Additionally, the nurse does not know that the client climbed over the side rails when the nurse was out of the room. Priority nursing tip: an incident, unusual occurrence, report is considered a legal document and should not be placed in the client's chart after completion. It should be maintained and filed in a designated area as determined by agency procedure. Question number 63. A home care nurse is visiting an older client recovering from a mild stroke affecting the left side. The client lives alone but receives regular assistance from the daughter and son, who both live within 10 miles. To assess for risk factors related to safety, which actions should the nurse take? Select all that apply. A. Assess the client's visual acuity. B. Observe the client's gait and posture. C. Evaluate the client's muscle strength. D. Look for any hazards in the home care environment. E. Ask a family member to move in with the client until recovery is complete. EF. Request that the client transfer to an assisted living environment for at least 1 month. Answer: letter A, B, C, D. To conduct a thorough client assessment, the nurse assesses for possible risk factors related to safety. The assessment should include assessing visual acuity, gait and posture, and muscle strength, because alterations in these areas place the client at risk for falls and injury. The nurse should also assess the home environment, looking for any hazards or obstacles that would affect safety. Asking a family member to move in with the client until recovery is complete and requesting that the client transfer to an assisted living environment for at least 1 month are not assessment activities. Additionally, nothing in the question indicates that these actions are necessary, therefore, these options are unrealistic and unreasonable. Priority nursing tip: age-related changes occur on an individual basis, and one client may experience an age-related change to a lesser extent than another client. The older client who has suffered a stroke will be at a higher risk for injury related to age-related changes. Question number 64. Which medical asepsis actions should the nurse implement to reduce and prevent the spread of microorganisms? Select all that apply. A. Practicing hand hygiene. B. Reapplying a sterile dressing. C. Sterilizing contaminated items. D. Applying a sterile gown and gloves. E. Routinely cleaning the hospital environment. F. Wearing clean gloves to prevent direct contact with blood or body fluids. Answer: letter A, E, F. Medical asepsis, or clean technique, includes procedures to reduce and prevent the spread of microorganisms. Practicing hand hygiene, routinely cleaning the hospital environment, and wearing clean gloves to prevent direct contact with blood or body fluids are examples of medical asepsis. Surgical asepsis involves the use of sterile technique. Examples of surgical asepsis include reapplying a sterile dressing, sterilization of contaminated items, and applying a sterile gown and gloves. Priority nursing tip: medical asepsis is intended to reduce and prevent the spread of microorganisms, whereas surgical asepsis aims to eliminate all microorganisms in a particular environment. Question number 65. The nurse is caring for a hospitalized client who is having a prescribed dosage of clonazepam adjusted. Because of the adjustment in the medication administration, which priority safety activity should the nurse plan to implement? A. Weigh the client daily. B. Assess for ecchymoses. C. Institute seizure precautions. D. Monitor blood glucose levels. Answer: letter C. Institute seizure precautions. Clonazepam is a benzodiazepine that is used as an anticonvulsant. During initial therapy and periods of dosage adjustment, the nurse should initiate seizure precautions for the client. This medication does not cause weight gain or loss, bleeding or bruising, or fluctuations in blood glucose levels. Priority nursing tip: flumazenil reverses the effects of benzodiazepines. Question number 66. The nurse is planning to obtain an arterial blood gas, or ABG, from the radial artery of a client with a diagnosis of chronic obstructive pulmonary disease, or COPD. To prevent bleeding after the procedure, which priority activity should the nurse plan time for after the arterial blood is drawn? A. Holding a warm compress over the puncture site for 5 minutes. B. Encouraging the client to open and close the hand rapidly for 2 minutes. C. Applying pressure to the puncture site by applying a 2x2 gauze for 5 minutes. D. Having the client keep the radial pulse puncture site in a dependent position for 5 minutes. Answer: letter C. Applying pressure to the puncture site by applying a 2x2 gauze for 5 minutes. Applying pressure over the puncture site for 5 to 10 minutes reduces the risk of hematoma formation and damage to the artery. A cold compress would aid in limiting blood flow. A warm compress would increase blood flow. Keeping the extremity still and out of a dependent position will aid in the formation of a clot at the puncture site. Priority nursing tip: before drawing blood for an ABG analysis, perform the Allen's test to determine the presence of collateral circulation. Question number 67. The nurse is admitting a client with an arteriovenous or AV fistula in the right arm for hemodialysis. Which strategy should the nurse plan to implement to best prevent injury to the AV fistula site? A. Applying an allergy bracelet to the right arm. B. Placing an alert bracelet per agency procedure on the client's right arm. C. Putting a large note about the access site on the front of the medical record. D. Telling the client to inform all caregivers who enter the room about the presence of the access site. Answer: letter B, placing an alert bracelet per agency procedure on the client's right arm. There should be no venipunctures or blood pressure measurements in the extremity with a hemodialysis access device. This is commonly communicated to all caregivers by placing an alert bracelet on the arm that needs to be protected. This alert bracelet prompts the primary healthcare provider to investigate the need for the bracelet. The use of an alert wrist bracelet, rather than a visibly posted note or sign, also maintains client confidentiality. Agency procedure is always followed. An allergy bracelet is placed on the client with an allergy. Placing a note on the front of the medical record does not ensure that everyone caring for the client is aware of the access device. The client should not be responsible for informing the caregivers. Priority nursing tip: to assess for patency of the AV fistula, feel for a thrill and listen for a bruit. The primary healthcare provider is notified immediately if disruption of patency is suspected. Question number 68. Regular insulin by continuous intravenous for infusion is prescribed for a client with diabetes mellitus who has a blood glucose level of 700 mg per deciliter, 40 millimoles per liter. How should the nurse administer this medication safely? A. Mix the solution in 5% dextrose. B. Change the solution every 6 hours. C. Infuse the medication via an electronic infusion pump. D. Titrate the infusion according to the client's urine glucose levels. Answer: letter C. Infuse the medication via an electronic infusion pump. Insulin is administered via an infusion pump to prevent inadvertent overdose and subsequent hypoglycemia. Dextrose is added to the for infusion once the serum glucose level reaches 250 mg per deciliter, 14.2 millimoles per liter, to prevent the occurrence of hypoglycemia. Administering dextrose to a client with a serum glucose level of 700 mg per deciliter would counteract the beneficial effects of insulin in reducing the glucose level. There is no reason to change the solution every 6 hours. Glycosuria is not a reliable indicator of the actual serum glucose levels because many factors affect the renal threshold for glucose loss in the urine. Priority nursing tip: regular insulin is a type of insulin that can be given by the intravenous route. When administering intravenous insulin, monitor the blood glucose level and the potassium levels closely. Question number 69. Which action demonstrates a situational leadership style by the nurse manager? A. The nurse manager delegates tasks to each team member. B. The nurse manager allows team members to work without supervision. C. The nurse manager invites team members to provide input about a unit problem. D. The nurse manager quickly delegates activities to team members during an emergency situation. Answer: letter D. The nurse manager quickly delegates activities to team members during an emergency situation. The situational leadership style uses a style depending on the situation and events. This type of leadership style is used in emergency situations when the nurse manager needs to quickly delegate activities to achieve a successful outcome for the situation. A laissez-faire leader abdicates leadership and responsibilities, allowing staff to work without assistance, direction, or supervision. Participative leadership demonstrates in between style, neither authoritarian nor democratic. In participative leadership, the manager presents an analysis of problems and proposals for actions to team members, inviting critique and comments. The participative leader then analyzes the comments and makes the final decision. The autocratic style of leadership is task-oriented and directive. Priority nursing tip: the nurse is always responsible for his or her actions when providing care to a client. Question number 70. The clinic nurse wants to develop a teaching program for clients with a diagnosis of diabetes mellitus. Which strategy should the nurse initiate first in order to best meet the client's needs? A. Assess the client's functional abilities. B. Ensure that insurance will pay for participation in the program. C. Discuss the focus of the program with the multidisciplinary team. D. Include everyone who comes into the clinic in the teaching sessions. Answer: Letter A. Assess the client's functional abilities. Nurse-managed clinics focus on individualized disease prevention and health promotion and maintenance. Therefore, the nurse must first assess the clients and their needs to effectively plan the program. Options B, C, and D do not address the client's needs related to the diagnosis. Priority nursing tip: when determining priorities for client teaching, identify the client's immediate learning needs, as well as what the client perceives as important. Question number 71. The nurse notes that a postoperative client has not been obtaining relief from pain with the prescribed opioid analgesics when a particular licensed coworker is assigned to the client. Which action is most appropriate for the nurse to implement initially? A. Reassign the coworker to the care of clients not receiving opioids. B. Notify the primary healthcare provider that the client needs an increase in opioid dosage. C. Review the client's medication administration record immediately and discuss the observations with the nursing supervisor. D. Confront the coworker with the information about the client having pain control problems and ask if the coworker is using the opioids personally. Answer: Letter C. Review the client's medication administration record immediately and discuss the observations with the nursing supervisor. In this situation, the nurse has noted an unusual occurrence, but before deciding what action to take next, the nurse needs more data than just suspicion. This can be obtained by reviewing the client's record. State and federal labor and opioid regulations, as well as institutional policies and procedures, must be followed. It is therefore most appropriate that the nurse discuss the situation with the nursing supervisor before taking further action. To reassign the coworker to clients not receiving opioids ignores the issue. The client does not need an increase in opioids. A confrontation is not the most advisable action because it could result in an argumentative situation. Priority nursing tip: if the nurse suspects that a coworker is abusing chemicals and potentially jeopardizing a client's safety, the nurse must report the individual to nursing administration in a confidential manner. Question number 72. The medication nurse is supervising a newly hired licensed practical nurse, LPN, during the administration of prescribed oral pyridostigmine bromide to a client with a diagnosis of myasthenia gravis. Which observation by the medication nurse indicates safe practice by the LPN? A. Asking the client to take sips of water. B. Asking the client to lie down on his right side. C. Asking the client to look up at the ceiling for 30 seconds. D. Instructing the client to void before taking the medication. Answer: Letter A. Asking the client to take sips of water. Myasthenia gravis can affect the client's ability to swallow. The primary assessment is to determine the client's ability to handle oral medications or any oral substance. Options B and C are not appropriate. Option B could result in aspiration, and option C has no useful purpose. There is no specific reason for the client to void before taking this medication. Priority nursing tip: to assess the client's ability to swallow, elevate the head of the bed to high fowlers and ask the client to sit up straight in bed before swallowing. Question number 73. The nurse does not intervene when a client becomes hypotensive after surgery. As a result, the client requires emergency surgery to stop postoperative bleeding later that night. The nurse could potentially face which types of prosecution for failing to act? Select all that apply. A. Felony B. Tort law C. Malpractice D. Statutory law E. Misdemeanor. Answer: letter B, C. Tort law deals with wrongful acts intentionally or unintentionally committed against a person or the person's property. The nurse commits a tort offense by failing to act when the client became hypotensive. Malpractice occurs when a duty to the client is established and the nurse neglects to act responsibly. Options A and E are offenses under criminal law. Option D describes laws enacted by state, federal, or local government. Priority nursing tip: malpractice is negligence on the part of the nurse. The nurse who does not meet appropriate standards of care may be held liable. Question number 74. The nurse gives medical information regarding the client's condition to a person who is assumed to be a family member. Later, the nurse discovers that this person is not a family member and realizes that this violated which legal concepts of the nurse-client relationship? Select all that apply. A. Duty to provide care. B. Client's right to privacy. C. Client's right of autonomy. D. Client's right to confidentiality. E. Duty to comply with nursing standards. Answer: letter B, D. Discussing a client's condition without client permission violates a client's rights to privacy and confidentiality and places the nurse in legal jeopardy. This action by the nurse is both an invasion of privacy and affects the confidentiality issue with client rights. Options A, C, and E do not represent violation of the situation presented. Priority nursing tip: leaving the curtains or room door open while a treatment or procedure is being performed constitutes an invasion of client privacy. Question number 75. In which situation is the nurse manager utilizing an autocratic leadership style? A. The nurse manager provides the solution for a unit problem. B. The nurse manager allows the staff to solve their own unit problem. C. The nurse manager proposes several alternatives and has the unit staff vote on the best proposal. D. The nurse manager arranges for a staff meeting where all unit employees can share proposals to solve a problem. Answer: letter A. The nurse manager provides the solution for a unit problem. The autocratic style of leadership is task-oriented and directive. The leader uses his or her power and position in an authoritarian manner to set and implement organizational goals or solutions. Decisions are made without input from the staff. The situational leadership style uses a style depending on the situation and events. Democratic styles best empower staff toward excellence because this style of leadership allows nurses to provide input regarding the decision-making process and an opportunity to grow professionally. Participatory leadership encourages input from the staff. Priority nursing tip: leadership is an interpersonal process that involves influencing others, followers, to achieve goals. Question number 76. The nurse performing an admission assessment notes that a client has been prescribed metoclopramide for a prolonged period. The nurse should immediately call the primary healthcare provider if which signs/symptoms were then noted by the nurse. A. Dry mouth. B. Anxiety or irritability. C. Excessive drowsiness. D. Uncontrolled rhythmic movements of the face or limbs. Answer: letter D. Uncontrolled rhythmic movements of the face or limbs. If the client experiences tardive dyskinesia, rhythmic movements of the face or limbs, the nurse should call the primary healthcare provider because these adverse effects may be irreversible. The medication would be discontinued, and no further doses should be given by the nurse. Anxiety, irritability, and dry mouth are mild side effects that do not harm the client. Priority nursing tip: metoclopramide stimulates the motility of the upper gastrointestinal tract and is contraindicated in clients with mechanical obstruction, perforation, or gastrointestinal hemorrhage. Question number 77. Which clinical situation should justifiably be viewed as an assault? A. The nurse threatens to apply restraints to a client who is exhibiting aggressive behavior. B. The client requests a medical discharge, but the nurse physically forces the client to stay. C. The charge nurse sends an email to a staff member that includes a poor performance evaluation about another person. D. The nurse overhears the primary healthcare provider making derogatory remarks to the client about the nurse's level of competency. Answer: letter A. The nurse threatens to apply restraints to a client who is exhibiting aggressive behavior. An assault occurs when a person puts another person in fear of a harmful or offensive act. Battery involves offensive touching or the use of force by a perpetrator without the permission of the victim. Defamation takes place when a falsehood is said, slander, or written, libel, about a person that results in injury to that person's good name and reputation. Priority nursing tip: false imprisonment occurs when a client is not allowed to leave a healthcare facility when there is no legal justification to detain the client. Question number 78. The nurse finds the client sitting on the floor, ensures the client's safety, completes an incident report, and notifies the primary healthcare provider of the incident. Which action should the nurse implement next? A. Staple the incident report in the client's medical record. B. Document the client events and follow-up nursing actions. C. Provide a copy of the incident report to the provider and family. D. Document that a copy of the report was sent to risk management. Answer: letter B. Document the client events and follow-up nursing actions. The nurse documents the incident completely and objectively in the client's record to communicate client data to the healthcare team. The incident report is a confidential, privileged, and internal document used to improve client safety and quality of care and therefore should not be copied, stapled, or placed in the chart. Furthermore, the nurse avoids referring to the incident report in the client's record, such as recording that the incident report has been sent to another department. These actions are necessary because any mention of an incident report in the medical record allows the plaintiff's attorney access to the document through discovery. Priority nursing tip: an incident report is used as a means of identifying risk situations and improving client care. Question number 79. A client had a colon resection. A nasogastric tube was in place when a regular diet was brought to the client's room. The client did not want to eat solid food and asked that the primary healthcare provider be called. The nurse insisted that the solid food was the correct diet. The client ate and subsequently required additional surgery as a result of complications. The determination of negligence is based on which premise in this situation? A. The nurse's persistence. B. A duty existed and it was breached. C. Not notifying the primary healthcare provider. D. The dietary department sending the wrong food. Answer: letter B. A duty existed and it was breached. For negligence to be proved, there must be a duty, and then a breach of duty. The breach of duty must cause the injury, and damages or injury must be experienced. Options A, C, and D do not fall under the criteria for negligence. Option B is the only option that fits the criteria of negligence. Priority nursing tip: negligence is conduct that falls below the standard of care. Question number 80. The nurse is caring for a child with a diagnosis of intussusception. During care, the child passes a formed brown stool. Which action is most appropriate for the nurse to take at this time? A. Note the child's physical symptoms. B. Prepare the child for hydrostatic reduction. C. Prepare the child and parents for the possibility of surgery. D. Report the passage of a normal brown stool to the primary healthcare provider. Answer: letter D. Report the passage of a normal brown stool to the primary healthcare provider. Intussusception is the telescoping of one portion of the bowel into another portion. Passage of a normally formed brown stool usually indicates that the intussusception has reduced itself. This is immediately reported to the primary healthcare provider, who may choose to alter the diagnostic or therapeutic plan of care. Although the nurse would note the child's physical symptoms, based on the data in the question, option D is the appropriate action. Hydrostatic reduction and surgery may not be necessary. Priority nursing tip: current jelly-like stools that contain blood and mucus are characteristic of intussusception. Question number 81. The nurse caring for a client with a diagnosis of end-stage kidney failure is asked by a family member about advance directives. Which statements should the nurse include when discussing advance directives with the client's family member? Select all that apply. A. A healthcare proxy can write a living will for a client if the client becomes incompetent and unable to do so. B. Two witnesses, either a relative or primary healthcare provider, HCP, are needed when the client signs a living will. C. The determination of decisional capacity of a client is usually made by the primary healthcare provider and family. D. Living wills are written documents that direct treatment in accordance with a client's wishes in the event of a terminal illness or condition. E. Under the Patient Self-Determination Act, PSDA, it must be documented in the client's record whether the client has signed an advance directive. F. For advance directives to be enforceable, the client must be legally incompetent or lack decisional capacity to make decisions regarding healthcare treatment. Answer: letter C, D, E, F. The two basic advance directives are living wills and durable powers of attorney for healthcare. Under the PSDA, it must be documented in the client's record whether the client has signed an advance directive. For living wills or durable powers of attorney for healthcare to be enforceable, the client must be legally incompetent or lack decisional capacity to make decisions regarding healthcare treatment. The determination of decisional capacity is usually made by the HCP and family, whereas the determination of legal competency is made by a judge. Living wills are written documents that direct treatment in accordance with a client's wishes in the event of a terminal illness or condition. Generally, two witnesses, neither of whom can be a relative or HCP, are needed when the client signs the document. A durable power of attorney for healthcare designates an agent, surrogate, or proxy to make healthcare decisions if and when the client is no longer able to make decisions on her or his own behalf. However, a healthcare proxy cannot legally write a living will for a client. Priority nursing tip: advance directives are used so that healthcare professionals can make decisions that are based on the client's wishes if the client is unable to make them. They clearly delineate end-of-life care decisions ahead of time so that appropriate action can be taken. Question number 82. A client asks the nurse how to become an organ donor. Which information should the nurse include in the discussion? A. The client can donate by written consent. B. A family member must witness the consent. C. The donor must be older than 21 years of age. D. A family member must be present when a client consents to organ donation. Answer: letter A. The client can donate by written consent. The client has the right to donate her or his own organs for transplantation, and any person who is 18 years of age or older may become an organ donor by written consent without the permission or presence of the family. In the absence of suitable documentation, a family member or legal guardian can authorize donation of the decedent's organs. Priority nursing tip: requests to the deceased's family for organ donation usually are done by the primary healthcare provider or nurse or designated person specially trained for making such requests. Question number 83. A registered nurse, RN, is providing post-mortem care for a deceased client whose eyes will be donated. Which measure should the nurse anticipate will most likely be prescribed that will provide appropriate care of the client's body? A. Closing the eyes with paper tape. B. Maintaining the client in a supine position. C. Placing gauze pads wet with saline covered by a small ice pack on the eyes. D. Placing the client in a lateral recumbent position, rotating right and left sides. Answer: letter C, placing gauze pads wet with saline covered by a small ice pack on the eyes. When a corneal donor dies, the eyes are closed and usually the primary healthcare provider prescribes placing gauze pads wet with saline over them with a small ice pack. Within 2 to 4 hours the eyes are enucleated, and the corneas are usually transplanted within 24 to 48 hours. The head of the bed should be elevated. With the head of the bed elevated, the eyes will likely remain closed. Priority nursing tip: donor eyes are obtained from cadavers and must be enucleated soon after death because of rapid endothelial cell death. Question number 84. A clinical nurse manager conducts an educational session for the staff nurses about case management. Which premise, if stated by one of the staff nurses regarding case management, should necessitate a need for further teaching? A. Manages client care by managing the client care environment. B. Maximizes hospital revenues while providing for optimal client care. C. Represents a primary health prevention focus managed by a single case manager. D. Is designed to promote appropriate use of hospital personnel and material resources. Answer: letter C, represents a primary health prevention focus managed by a single case manager. Case management represents an interdisciplinary healthcare delivery system to promote appropriate use of hospital personnel and material resources to maximize hospital revenues while providing for optimal client care. It manages client care by managing the client care environment and includes assessment and development of a plan of care, coordination of all services, referral, and follow-up. Priority nursing tip: case management involves consultation and collaboration with an interprofessional healthcare team. Question number 85. A registered nurse is delegating activities to the nursing staff. Which activities can be safely assigned to the unlicensed assistive personnel, UAP? Select all that apply. A. Collecting a urine specimen from a client. B. Obtaining frequent oral temperatures on a client. C. Assessing a client who returned from the recovery room 6 hours ago. D. Assisting a post-cardiac catheterization client who needs to lie flat to eat lunch. E. Accompanying a client being discharged to meet his spouse at the hospital exit door. Answer: letter A, B, E. Work that is delegated to others must be consistent with the individual's level of expertise and licensure, if any. Options A, B, and E do not include situations that indicate that these activities carry foreseeable risk. The least appropriate activities for the UAP would be assessing a client and assisting the post-cardiac catheterization client. The UAP is not trained or educated to safely and accurately perform an assessment on a client. Because the post-cardiac catheterization client needs to eat while lying flat, the client is at risk for aspiration. Priority nursing tip: generally, non-invasive interventions such as skin care, range of motion exercises, ambulation, grooming, and hygiene measures can be assigned to UAP. Scope of practice: for registered nurses or RN, they must do the following: clinical assessment, initial client education, discharge education, clinical judgment, initiating transfusion. For the licensed practical nurse or LPN and licensed vocational nurse or LVN, they must do the following: monitor RN findings, reinforcing education, routine procedures, example catheterization, most medication administrations, ostomy care, tube patency and enteral feeding, specific assessment. 4. Unlicensed assistive personnel, they must do the following: activities of daily living, hygiene and linen change, routine stable vital signs, documenting input and output and positioning. Limited assessments, example, lung sounds, bowel sounds, neurovascular checks. Question number 86. The nurse manager is reviewing the critical paths of the clients on the nursing unit. The nurse manager collaborates with each nurse assigned to the clients and performs a variance analysis, which finding should indicate the need for further assessment and analysis. A client is performing his or her own colostomy care. B. A one-day postoperative client has a temperature of 98.8 degrees Fahrenheit 37.1 degrees Celsius. C. A two-day post-abdominal hysterectomy client has drainage noted from the incision. D. A client newly diagnosed with diabetes mellitus is preparing his or her own insulin for injection. Answer: letter C. A two-day post-abdominal hysterectomy client has drainage noted from the incision. Variances are actual deviations or detours from the critical paths. Option C is the only option that identifies the need for further action. Variances can be either positive or negative, or avoidable or unavoidable, and can be caused by a variety of things. Positive variance occurs when the client achieves maximum benefit and is discharged earlier than anticipated. Negative variance occurs when untoward events prevent a timely discharge. Variance analysis occurs continually to anticipate and recognize negative variance early so that appropriate action can be taken. Priority nursing tip: variation analysis is a continuous process that the case manager and other caregivers conduct by comparing the specific client outcomes with expected outcomes. Question number 87. Which client should the nurse safely assign to the unlicensed assistive personnel, UAP? A. A client requiring dressing changes. B. A client requiring frequent ambulation. C. A client on a bowel management program requiring rectal suppositories. D. A client newly admitted with nausea, vomiting, and moderate neck pain. Answer: letter B. A client requiring frequent ambulation. Assignment of tasks to UAP needs to be made based on job description, level of clinical competence, and state law. The client described in option B has needs, frequent ambulation, that can be met by UAP. Options A, C, and D involve care that requires the skill of a licensed nurse. Priority nursing tip: client safety is the priority when determining which tasks can be delegated and to whom. Scope of practice: for registered nurses or RN, they must do the following: clinical assessment, initial client education, discharge education, clinical judgment, initiating transfusion. For the licensed practical nurse or LPN and licensed vocational nurse or LVN, they must do the following: monitor RN findings, reinforcing education, routine procedures, example catheterization, most medication administrations, ostomy care, tube patency and enteral feeding, specific assessment. 4. Unlicensed assistive personnel, they must do the following: activities of daily living, hygiene and linen change, routine stable vital signs, documenting input and output and positioning. Limited assessments, example, lung sounds, bowel sounds, neurovascular checks. Question number 88. A client with a diagnosis of schizophrenia and psychosis is pacing, agitated, and presenting with aggressive gestures. The client's speech pattern is rapid, and the client's affect is belligerent. Which priority nursing intervention based on these objective data should the nurse implement? A. Provide safety for the client and other clients on the unit. B. Bring the client to a less stimulated area to regain control. C. Provide the clients on the unit with a sense of comfort and safety. D. Assist the staff in caring for the client in a controlled environment. Answer: letter A, provide safety for the client and other clients on the unit. If a client is exhibiting signs that indicate loss of control, the nurse's immediate priority is to ensure safety for all clients. Option A is the only option that addresses the client's and other clients' safety needs. Option B addresses the client's needs. Option C addresses other clients' needs. Option D is not client-centered. Priority nursing tip: encourage the client who is agitated to talk out instead of acting out feelings of frustration and aggression. Question number 89. The nurse manager is developing an educational session for nursing staff on the components of informed consent and the information to be shared with the client to obtain informed consent. Which information should the nurse manager include in the session? Select all that apply. A. The client needs to be informed of the prognosis if the test, procedure, or treatment is refused. B. The client cannot refuse a test, procedure, or treatment once the test, procedure, or treatment is started. C. The names of the persons performing the test or procedure or providing treatment should be documented on the informed consent form. D. A description of the complications and risks of the test, procedure, or treatment, as well as anticipated pain or discomfort, needs to be explained to the client. E. The nurse is responsible for obtaining the client's signature on an informed consent form even if the client has questions about the test, procedure, or treatment to be performed. Answer: letter A, C, D. Informed consent is a person's agreement to allow something to happen based on full disclosure of risks, benefits, alternatives, and consequences of refusal. The primary healthcare provider, HCP, is responsible for conveying information and obtaining the informed consent. The nurse may be the person who actually ensures that the client signs the informed consent form. However, the nurse does this only after the HCP has instructed the client, and it has been determined that the client has understood the information. The following factors are required for informed consent: a brief, complete explanation of the test, procedure, or treatment, names and qualifications of persons performing and assisting in the test, procedure, or treatment, a description of the complications and risks, as well as anticipated pain or discomfort, an explanation of alternative therapies to the proposed test, procedure, or treatment, as well as the risks of doing nothing, and the client's right to refuse the test, procedure, or treatment even after it has been started. Priority nursing tip: an informed consent is a legal document. The client needs to be a participant in decisions regarding healthcare and can withdraw consent at any time. Question number 90. Wrist restraints have been prescribed for a client who is continuously pulling at the gastrostomy tube. The nurse develops a care plan and should determine that which findings would be negative outcomes related to the use of restraints. Select all that apply. A. The client is increasingly agitated. B. The client's left hand is pale and cold. C. The client's skin under the restraint is red. D. The client verbalizes the reason for the restraints. E. The client is unable to reach the gastrostomy tube with his or her hands. F. The client demonstrates behavior that includes biting the attending staff. Answer: letter A, B, C, F. A physical restraint is a mechanical or physical device used to immobilize a client or extremity. The restraint restricts freedom of movement. Negative outcomes in the use of restraints include signs of impaired skin integrity such as redness or skin breakdown, altered neurovascular status such as cyanosis, pallor, coldness of the skin, or complaints of tingling, numbness, or pain, increased confusion, disorientation, or agitation, or injuring staff. Client verbalization of the reason for the restraints and the client's inability to reach the gastrostomy tube with his or her hands are expected outcomes. Priority nursing tip: if the restraints are placed on a client during a period in which the behavior cannot be controlled, or in an emergency situation, a primary healthcare provider's prescription for the restraints must be obtained in a timely manner. Additionally, the continued need for restraints needs to be assessed regularly according to agency policy. Thank you for watching and listening. Please subscribe and click the notification bell to be updated for more videos.